When it comes to growing your practice, one of the most common challenges that we see with our clients is poor internal alignment of their team. Solving that problem doesn't have to be hard. Let's talk about it. Hi, it's Jason Parkinson from ONEFIRE. Most healthcare practices have lots of stakeholders involved when it comes to decision making. And if we think about this through the lens of marketing decisions, typically you have an internal marketing point person, a practice administrator, senior doctors in the practice, and patient coordinators and others that you have to get on the same page. If you run a marketing campaign without having the right alignment internally, the campaign is not going to be nearly as successful as it could be with everyone on the same page. In the Align phase of the ONEFIRE Patient Growth Program, we spend time helping you organize your team internally for maximum results externally. Let me show you what I'm talking about. When it comes to organizing your internal team, we've got a playbook that we use with a lot of our clients, and I'm just going to take you through the first little piece of this here to kind of give you a level set of what we're trying to accomplish. There's all different types of things inside of a practice that you have to think about aligning a team on. You've got things like different service lines. You've got decisions to make around calculations for ROI, like the lifetime value of a specific patient. How about different promotions? For elective healthcare, things like discounts, things like upsells or add-ons, things of that nature. And one of the more important things is just process. You know, when you get a new lead into your organization, what are you doing? What's the process that's going to go through to make sure it's handed off in the right manner? And you've got all of these different stakeholders internally here, right? You've got yourself, maybe in a marketing role. You've got the practice leadership, or what we would maybe consider, senior doctors in the practice. You've got a patient coordinator who's going to be kind of the front lines of dealing with the patient. And the important thing is, before you can move this box of all of these items forward, you really need to make sure that everyone comes in and gets aligned to be able to think the same way about all of these specific items. You may be thinking, why does it matter if everybody in the organization is aligned on something like lifetime value? Well, think about it. From a reporting standpoint, you want to be able to show the value that your marketing campaign's providing. And so every butt in a seat that you put in place for a procedure has a dollar value to your practice. And so if you're spending dollars on bringing in leads and bringing in new patients, you want to make sure that it's the right amount of money that's being spent to produce the maximum amount of ROI for the practice. In fact, your leadership, your patient coordinator, your marketing team, everyone needs to be aligned so you have that accurate reporting of ROI from your efforts. And so everyone knows just how incoming leads are being handled and who's responsible for what. That's on the process side of things, right? If you have a lead that comes in on a Tuesday afternoon and is treated completely differently than a potential lead that comes in on a Thursday morning, well, that's a problem. You kind of have to choreograph that experience for your leads and make sure that they get handed off to the right person throughout the process as well. So really, the alignment of your internal team is mission critical. So let me ask you this. Do you feel like your team is currently aligned at your practice? Why don't we jump on a free 45-minute strategy call and just talk through where things are at in your practice today, where you'd like them to go, and maybe what roadblocks are in the way. I'll put the link here with the video so you can schedule a call at your convenience. All right, that's it this week. I'll talk to you guys soon.